Okay, so I'm going to spend the first, I think, hopefully no more than 10 minutes going through what I think are highlights of our program to give an idea of who we are. I'd like to introduce who else I have on the call with me and myself as well. So I'm Kelsey Kelly. I'm the program director for the KU Family Medicine program. We're housed in Kansas City, Kansas. Also on the call, I have Kristen Estrada. She's our residency coordinator. I have Dr. Kaylee Kermer-Voss, one of our third-year residents and one of our chief residents as well. And then I have Dr. Nicole Yadlinski, one of our residency core faculty, also POCUS champion, also sports medicine fellowship core faculty as well. So also rules of engagement, please. Because there's a big group of us, we are asking that you put questions in the chat box, and we'll get to those at the end of the presentation. So any questions that you have, please put them in the chat box. And also to let you know, because this is such a short time together, 20 minutes is going to go by pretty quickly. At the end of the round robin session with the residency programs, if you come back to visit us, we're going to have a lot more residents available and our own link to a separate Zoom meeting so that you can do breakout rooms individually with different residents to get a better idea of who we are and who our residents are for our program. Okay, so getting started, it's always fun to share what the aim and mission of our program is. And our aim is to develop physician leaders who partner with their communities to decrease health disparities. And we do this by training intellectually curious, compassionate, and competent family physicians who are committed to caring for the underserved. And I think what I want to say about this is that we really do our best within our residency program to make sure that everything we do within our program is guided to meet our aim. And so we're constantly thinking about how does this benefit the community? How is this going to improve the community with which our residency program serves? And also by doing this, we believe and have seen that our residents who graduate are prepared to practice in any setting, whether it's urban, rural, suburban, international, going to a fellowship, hospital medicine, outpatient medicine, both academics, you name it, our program will, in our opinion, prepare you for that. Why KU? There's a lot of reasons why KU, and I'll try to hit some of the highlights here. From a community engagement perspective, you know, again, we're training physicians to care for the underserved. In our setting, it's an urban underserved area sitting in Kansas City, Kansas. And so not only are we working in an academic center, but it's important to get out into the community. So throughout residency training, you're going to see that there is community-based required rotations where you have to go work within the community and learn from that perspective rather than just in the walls of the academic center. The other thing is that because we serve an underserved population, from a learning perspective, that provides opportunity for learning from patients that have complex medical issues, as well as the social determinants of health that can make those complex medical issues a little bit more challenging to deal with when there's access to care issues and other things that may impede optimal care. The other thing is working in an academic medical center, you have all the specialists at hand, so you get to learn from the people who are top-notch in their field. And of course, we believe we have quality education as well. Two other things I want to point out too is that our program is very focused on interprofessional collaboration, and you'll see that throughout this short presentation today. And the other thing I think our program offers is just opportunity. So opportunity to explore your interests, whether it's through elective opportunities, leadership opportunities, research opportunities. But because we're in an academic medical center, really the opportunities are endless. And so our goal as faculty is to help guide residents into their area of interest so that you can get the most out of your residency program. More about YKU, this is also on our residency website as well. You can check us out there. Lots of different educational experiences. We are fortunate, again, to be an academic medical center where we have state-of-the-art facilities, always some new shiny toy coming our way. And we have faculty who are interested in education, who the only reason they're working at an academic medical center is to teach and to educate and work with learners of all stages in their training. And so it's not uncommon to have an immediate little 5-minute pearl with your infectious disease doctor who you're consulting with because they want to teach, they want to help the family medicine doctor become the best doctor that they can be. And again, a little bit on the interprofessional opportunities. Our residents get training in also PALS, point of care ultrasound or POCUS, as I mentioned, We have lots of women's health opportunity for training as well in terms of colposcopy, endometrial biopsies, and LARCs. Again, because we're an academic medical center, we have access to a very robust simulation program. And each class of residents usually goes through the sim lab at least 2 times. We're working on 3 times per year to do both inpatient, outpatient simulations. We've got all the fancy stuff, and recently we're able to use our the pregnant mannequin to practice shoulder dystocias, which is fun for the second year. What was I going to say? I think, you know, unfortunately the pandemic has put a damper on it recently, but as you can see, we're back in the sim lab with masks on. The other thing I'll comment with the sim lab is the vast majority of our simulations are done in an interprofessional manner, because really it's all about communication and teamwork. And so we often have our nursing staff working with us doing our simulations. I'm not going to go into the curriculum in great detail, but this is just to point out that we have a lot of elective opportunity. And during your second year, we try to ensure that you have 1 block of elective opportunity, and during your third year, 3 blocks, if not a little bit more, so you can continue to get the residency experience you want in order to become the family doc that you want after graduation. We have a robust inpatient service, and you will get great training when it comes to hospital medicine. We are also fortunate that we have great geography. So the 7th floor of the Heart Hospital is where 70% or so of our patients are placed when they're admitted. So it makes for a great relationship with our nursing staff on that team. And we get to know our nursing staff, as the residents do, at least for all 3 years, and we get to watch each other grow and learn from each other. And again, we do simulations together. The other thing I'll point out about our inpatient team is it's interdisciplinary as well. So we always have a pharmacist rounding with us. We have a social worker and a nurse case manager who our residents are in regular contact with as well, to ensure that we are moving forward in terms of discharge and doing the right things for our patient. Our outpatient clinic is housed on the main campus in Kansas City as well. One thing I'll highlight too about our clinics and our longitudinal clinics is that we also work in 2 FQHCs in Kansas City, Kansas. One is our prenatal clinic. We affectionately call it the mom clinic. And another clinic in Vibrant Health is our pediatric longitudinal clinic that we just started about a year ago. So it's a growing clinic, and we're excited about that collaboration as well. Again, with the mindset that our program has this goal of, while being academically rigorous, getting out into the community, serving the community, and learning from the community is what family docs need to be doing, in our opinion. Lots of different clinic opportunities you can check out on our website. More discussion here about how our desire to work in the community and the different collaborations that we have within our community on our website as well. And not only are those things woven within the rotations residents do, but also we do back to school fairs. We do high school physicals with one of the local high schools, and hopefully we'll continue doing that once the pandemic ends and school sports start back up again. We have a Walk with a Doc program that we've had over the past year, which is growing in success. So lots of opportunities to get out into community and find what reinvigorated you about medicine in the first place. Lots of faculty. We have faculty there with varying interests. Here's our residency core faculty. Again, check it out on the website. We have maternity care faculty. I'll point out here that I know there was a lot of applicants or students on this call who are interested in obstetrics. Ours is a program where you will not get surgical obstetric experience, but I'm also a program director who very much loves and enjoys maternity care and delivering babies. And I think it's important that family medicine doctors graduate with experience in at least being competent in low-risk vaginal deliveries. And so all of our residents are required to have 40 deliveries upon graduation. So just to put that in your minds. We have hospitalists dedicated to our own service. One of the questions in the previous group was if we have our own inpatient service, and we absolutely do. In fact, we have 2 teams because our census got so big recently. We have geriatricians who also participate in the Geriatrics Fellowship, which is under the Internal Medicine department. Our sports medicine faculty, again, Dr. Yelinsky is on our call. We do have a primary care sports medicine fellowship, and we are currently on our 4th fellow this year, our 4th year with our 4th fellow, which is growing in success. I keep talking about interprofessional activities, and so we have integrated behavioral health team, and our psychologists are ready at a moment's notice to come into a patient's room if needed in clinic to make sure that we're addressing all aspects of the patient, so whole person care, person-centered care. Again, highlighting our interprofessional opportunities. We have an interprofessional teaching clinic. And so I think one thing that's important about our program, or maybe is a little different, is that our residents work with medical students, and that's sort of a requirement in terms of learning. So not only are you a learner as a resident, but also you will be working with medical students and helping them learn as well. And our third years work intimately with our interprofessional students in terms of medical students, pharmacy, PT, OT, nursing students, psychology students, and all together they go see a patient. And then the third year acts essentially as the attending, offering the education for the team, providing care for that patient, giving feedback and all sorts of stuff, with the goal to empower residents so when they graduate, they continue to take medical students or other learners into their practice to pay it forward. Department leadership. We have community health leaders. I'll point out right now with the pandemic, our top 3 here are public health officials for the 2 counties that we mostly serve, and so they've been a great addition. We're happy to have them in our department. We've got lots of research faculty. Our department, our division is bringing in lots of research dollars, so good opportunities for our residents to get involved in community-based participatory research, participate in national and international poster presentations or oral presentations, which has been fun to see. Global health opportunities, lots of leadership opportunities. I'm going to just scroll through some fun pics. Our residents do like to have fun. We scavenger hunt. We have every year a resident retreat. We did painting last year. We like to have fun on the holidays, getting dressed up in Halloween. And then recently for our residency retreat, we got to do some cooking classes, which was fun to see everyone's cooking skills. So I think I'm going to end there. I'll say we're on social media, follow us, and we today just finished our promotional video shoot, so we're excited to see how that comes together, and we'll be sharing that with the world here in the next few weeks. All right, so I have zipped through. I will stop share, and if there's any questions. If not, we'll let Kaylee, Dr. Kummer-Voss, say a few words.
All right, while we wait for you guys to ask some questions, I just wanted to tell you a little bit about the program and things that just make it unique, reasons why I chose KU in Kansas City. So we are a big academic center, so it was important to me to be able to learn from the specialists who are the top of their field and be able to work with them and learn key pointers from them, because at the end of the day, a lot of times when we do refer our patients to these specialists, our patients may have to wait several months before they get into somebody that they need to see. So what I've learned as a resident working with these providers is what can I do in the meantime to help my patients while they're waiting, and what can I do as far as workup. So it's good to have that working relationship and see a different perspective of how people do things, but also to know, like, what can I do as a family medicine provider, and also learning from my family medicine attendings. I know we have a 5-minute warning, so if somebody has a burning question, please ask. If not, come back to join us after 8. There's a link that we have in the chat box. And I don't know if Kristen can comment it or copy it again so people who join late can see it. Let's see, Dr. Kelly, do you want to take this question or these questions about?
Yeah, for international medical graduates, preferably 2 years is back from when you graduated is what we're looking at for applicants. And we, Kristen, let me get it right. We do J1s, not H1Bs.
That's correct. We do J1 visa.
Yep, absolutely. Dr. Yadlinski, do you have any comments you want to say out there in the soccer field?
Sorry. I'm in true family medicine multitasking. I had a full morning of clinic and then afternoon procedure clinic with vasectomies and skin stuff, and now I'm at my son's soccer game. So if you see me like shouting, that's what I'm shouting about. So I'm sports medicine fellowship trained. I also have passion for point of care ultrasound. I also am one of the maternity care faculty, so I obviously have a wide range of interests and love to support residents and residency education.
All right, and I'll say a couple more things while we have time before you guys have to leave. Another thing I think is important to know, I know we keep talking about how KU is a big academic center. I just want you guys to know it's not a scary, huge academic center, like you will find your way through the hospital. It's very easy to navigate. Everybody's really welcoming to have that Midwest charm, I guess you could say. So I don't want you guys to like be afraid of the big academic center, because actually it's something that I've come to really enjoy, and being able to, walk across campus can take you like 5 minutes. So it's not terribly huge, but we do have all of the access to all the things that an academic center provides. Let's see, there's a couple more questions for Dr. Kelly, I think, here.
Yeah, I can answer those in the chat box. I think I was going to say, I just lost my thought. It's gone. It's totally gone. One of the other questions. Go ahead.
Well, I was just going to say that like one of the strengths of our program is definitely that we have every faculty sort of has their own little niche. And so whatever interests you, whatever you want to pursue additional training on or education on, we have sort of a faculty member who is an expert in that field and is happy to take individual residents under their wing to give them that extra training in whatever field they're interested, or sometimes more than one field too.
I also want to add on to our faculty are awesome, and pretty much everyone has an open door policy. I mean, I have everybody's phone numbers on my phone. If there's anything that I need, I can call any of them at any point in time. So I feel like not only do they care about our education as residents and watching us grow, and they enjoy teaching, that's why they're here, but also they check in on us and make sure that our lives are, going okay, because you have to be a happy person and have your life, in somewhat of an order, so you don't have all this chaos in order to be a successful resident. So I feel like our faculty does a really good job of being open and checking in on us and treats us like we're part of the family.
I think that segues into the comment I was going to have in terms of, there was a question before about mentorship and how we structure that. And so the first 6 months of intern year, interns are assigned to residency core faculty as their mentor, because when you get here, you don't know anybody and you don't know whose personality you might mesh well with, or who's got what interests. And then as we near the end of that first 6 months, then you get to select your top 2 or 3 faculty you'd like to be paired with as a mentor, so that they can help guide you through the remainder of your residency and help you become the doc that you want to be. I've said that anybody can teach you how to manage diabetes, but if there's a particular area of interest that you have, our goal and our job is to try and make sure we get that manned for you or figured out for you. Sasha says, stay in your current room. I will move you to next session. If you end up in a room you've already visited, come to the waiting room. Okay, all right. We'll stay put. Are there any other questions anybody has they want to throw in the chat box? Or just a reminder that if you decide to come back to our room afterwards, we will have more residents available to do one-on-one conversations in a breakout session. So we appreciate you joining us, and hope you enjoy the rest of the evening.
Hey, I'm not sure what I'm supposed to do. I'm on my mobile app, and I saw someone said like stay in the current room and they're gonna move me. So I don't know. I jumped on this late. I didn't get off until like 6:30. So I'm not sure how y'all have been doing it.
So they will move you, I guess, when it's time, because that's different than what happened last time.
Okay, sounds good. Yeah, because I ended up going to like the main waiting room, and like all of these students got dumped into the main waiting room, and they got put back in the same one they had just came out of, because I think they had lost track about who had been where and all that stuff.
Yeah, which is why I think they're having people stay in maybe the room this time.
Okay, great. Sounds good.
We appreciate patience as we figure this out. This is a lot
Yeah,
of
no, I
people.
totally understand. I just didn't know if like you all were waiting for like some of us, more of us to leave or whatever like that. I just didn't, want it to be like awkward as we both just sat here or whatever.
No, yeah. We can talk about other things.
We can totally all be awkward together.
Yeah.
I have a
Right.
question actually.
Yeah.
Sorry, about the sports medicine. So this is probably a really difficult question because I know it's really uncertain which sports are going to be going this next year. But how are you guys kind of managing the like training with sports medicine?
Dr. Yadlinski, you want to take that?
Yeah, so we actually, so KAFP, which is the Kansas State High School Athletic Association, we are proceeding with high school athletics. So yeah, we are, and I cover one of the local high schools, and residents are welcome to join me for any sideline activities. KU athletics is moving forward. So yeah, we still have quite a few. Obviously, I'm here at my son's soccer game, so we still have athletics going on in the Kansas City area. So there's plenty of opportunities.
We do have a sports medicine rotation too. So as a third year, you'll be able to work with some different sports medicine faculty. We get to work with Dr. Yadlinski a lot. We're spoiled. But we have a couple of different faculty who we go to their clinics and work with them just in their normal sports med clinics. So not only just like covering the school sports, but we get to see like what they're doing in the clinic world too, and
Yeah.
getting to do like injections and things like that too.
Yeah, KU actually has sports medicine clinics throughout the Kansas City metro area, to include Lawrence. There's a clinic out at Arrowhead, which is where the Kansas City Chiefs play. And then there's a clinic in what's called Indian Creek, which is down in Overland Park. So there are plenty of places to see sports medicine patients in the Kansas City metro area.
I will say that clinic out of Arrowhead is very, very, very nice. I got to work out there with one of our faculty, Dr. Darsh, and he's an ex-NFL football player too. So that's kind of cool to see his perspective on things, going from playing professional sports to treating professional sport athletes.
The qualifier being you're not caring for the Chiefs.
Yes, that is the qualifier.
Yeah.
Just his own like personal patients who happen to go out to Arrowhead for their care.
Yeah. They don't let learners practice on $1 million joints.
That they do not.
So I had a question about, I heard about I think it was a former Chiefs player that built like a biomechanics research lab that he did his own training at and stuff. Do you all do any sort of research projects there or anything? I might have missed that if it got brought up.
So you can. So what there is it's the KU Sports Medicine Performance Center is out in the Kansas City metro area, and KU has PT out there, they have athletic training out there, they have strength and conditioning coaches out there, and they do a variety of activities. And so residents have the opportunity, if they so wish, to do any type of research that they want to partner with those departments, again, with that interprofessional collaboration. It's a fantastic facility. Again, like I said, my son's a soccer player, and they have an ACL injury prevention program that he went through out there that was fantastic.
And I'll just piggyback on that with research. So part of being able to be board eligible to take your boards, you will do a research project and a quality improvement project. So we have a very robust research faculty and department here at KU. So pretty much any kind of research project you want to do, if there's something you're interested in, you can approach any of the faculty, and they'll either plug you in with the right people to get you started, or find a way to get you to be able to do the research you want to do. I worked on some veteran research, kind of creating like a screening scale for veterans to try to catch people who were missing for like PTSD and like moral injury, and the difference between those. And Dr. Yadlinski was one of my advisors for that. So people will come and find you if you show them your interest in research.
Great, glad to hear it.
And you're also presenting it, right, Kaylee?
Yeah, we're going to present our poster at FMX this year. We got accepted to that. So that's pretty exciting that we get a national platform to present the research that we've done.